Hello everyone, I am Dr. Barkha Bhoneja and I welcome you again to the series of Articulators lecture. We had already covered the requirements, the introduction, the basic classification of the articulators. Now we are moving to the limitations and how do we select an articulator for every case. I am Dr. Barkha Bhoneja, Senior Lecturer from Department of Prosthodontics, BBD College of Dental Sciences, BBD University. So let's move on to the area where we had left. We had already discussed the classification of the articulator. Now, we are moving to the laws of articulation. So we are going to briefly go with this part of the lecture because this is mostly covered in balance occlusion, which is a altogether different topic. So Rudolf now stated that the five most important factors are the inclination of the condylar guidance. Now we have already been discussed that the condyle in the articulator eminence. Now this inclination of the condyle. Now when the condyle is moving, if this in this inclination, or it can be steep where your condyle is moving very steeply, or it can be a little bit, flatter part, or you can just. So this is how your inclination of the condylar guidance differs. So the prominence of the compensatory curves. So in complete denture, while we are doing a teeth arrangement, we set teeth in certain curves, as well as certain curves are present in our mouth. So these curves we also have to follow in the complete denture. So how are we putting these curves? Okay, that also depends. Inclination of the plane of orientation. Plane of orientation means the how the students like you make your occlusal rims and then you set on your 3-point articulator where you compensate, put it in the Bonneville's triangle theory. So how you incline that plane of orientation? Inclination of incisal guidance. Now, incisal guidance is your upper teeth in relation to your anterior teeth. You know where is your incisal rod, and the flat surface on which your incisal rod stands is called as the incisal guide table. Now, this table can be inclined 30 degree, 10 degree, 40 degree. How much ever you incline that plane, your teeth, that is your upper and lower, will move according to that inclination. Height of the cusps. So cusps of the teeth also influence your articulator. Now, we are going to very briefly go over it. Now, condylar inclination is a definite anatomical conception. It is one factor which the dentalist patients represents. Can in no way be modified by the operator. It is one of the end controlling factors. Now, condylar inclination is given by the patient, so we cannot change it. Incisal guidance. Now, this is something that you set after taking the jaw relation of the patient. The height of the cusp, we always use a semi-anatomic teeth for complete denture patients because they're easy to balance. So we use it. So height of the cusp is usually, in our cases, it is predetermined. Plane of orientation, you always set your teeth arrangement at this level, at your level, at the Bonneville's triangle theory. And the prominence of the compensatory curves. The compensatory curves are that how you place your teeth, right? Your buccal cusp is touching, your buccal and lingual cusps are either touching, or your mesiopalatal cusp is touching. All of these teeth settings in complete denture, this is nothing but just your compensatory curves. You are giving them curves. You're placing your teeth into curves, okay? Now, the most important thing I would like to tell you in this is your parts of the articulator. The parts of the articulator, if you can see my cursor moving, the upper part is called as the upper member of the articulator. Okay. Similarly, the lower part is the lower member of the articulator. This is the articulating discs over which your maxilla and mandible cast will be attached. Now, this is basically a wide view type of Hanau series articulator. Okay, now this part, can you see, this is the condylar area where this is the condylar element and this is the condylar guidance pathway. Can you see the various markings of degrees can be positive and negative? So when you rotate this, your condylar path will change. Now, another thing is that here you can see another marking over here. Now, this is the lateral condylar guidance. This is the horizontal condylar guidance. This is the lateral condylar guidance. So, these are both type of condylar guidances only. Now, there is these two condylar guidance forms the posterior reference point, the and the two posterior reference point and the first one anterior reference point. Can you see this arrow over here? This arrow is the orbital pointer. This is the orbital pointer, which is the anterior reference point. Now, this is your incisal rod, which is two directed two ends. This is the spherical end and this is the chisel end. Now, chisel end is kept. This is the incisal guide table where you can see there are another markings. So, incisal guide table can also be shifted to various inclinations, like I told you before, 10, 20, 30, how much you want. Okay, so these are the basic parts of the articulator. These are thumb screws, screws to open and close the various parts of the articulator. Okay, this is a mechanical device. Okay, sterilization has to be a cold sterilization of these articulators. You have to oil them. You have to always kept it clean. Now we move on to articulator selection. One should not use too complex instrument for a simple case, okay, or a too simple articulator for a complex case. Now this is, I have taken this part from Hartwell book. If you go to Hartwell, you will see a beautiful chapter on articulators. Okay, so it's not like you can use any articulator for any cases. Any simple case, you can use a simplex or complex articulator, but is that complex articulator required? You have to ask yourself. It will definitely perform the same function, but is it really required? No. So for a simple case, a simple articulator may justify because it is easy to use, it is time saving. Always you have to think clinically. The following factors pertinent to the understanding and selection. Okay, now let's see. Articulator movements of the condylar elements do not reproduce condylar movements in the temporomandibular joint. Okay, that means the thing is, it does not exactly copy. You cannot just copy your condylar guidance into the articulator, but you can somehow come to an extent where, okay, you can come to an extent where the condylar guidance is somewhat similar to that in the mouth. The goals of articulation is to duplicate tooth movement along border pathways in at least two planes of spaces. Okay, so the goal of articulation is, however the tooth is moving, the move has to be same when you are using in the articulator. The most important requirement of an articulator are to maintain centric relation and vertical dimension and occlusion. So this is the basic requirement. This is the first thing that you learn as a second year or final year of BDS. You see, the first thing we teach you is to how to take a centric relation. But from the mouth to shift it to the articulator, your articulator should be so rigid at certain points where it can maintain that same centric relation and vertical dimension of occlusion. Okay? Fixed condylar elements add 110 are all that is necessary, and adjustable condylar capability may permit more records to be accepted. That is, when you are doing a complete denture patient, it is not required to take the internal condylar guidance of the patient. Why? Because if you keep it an average value of 110, you can take an articulators with the average value of 110 millimeters. So all average arbitrary value articulators have intercondylar distance of 110 millimeters. So you can take that. Okay, for complete denture, not so much precision is required. The articulator should be able to receive a phasebow transfer. Phasebow transfer, definitely. The maxillary alignment of the is necessary. The articulator should have the capability of adjustment for precurrent or immediate side shift up to at least 25. That is the Bennett movement. A stereograph has limited value for all, but a few types of prosthodontic situations, whereas in full mouth rehabilitations and everything, you can use a pentograph. Okay. Last but not the least, we are moving on to limitations. Now, the articulators they are made of metal materials. So, metal articulators can undergo repeated use of metal fatigue. The articulators may not exactly stimulate. Now, the dynamic jaw cannot be exactly stimulated from the mouth to the articulate. There are certain limitations. Or either errors in jaw relation procedure are reproduced as error in occlusion. That means if you start an error in the beginning, this error is going to continue till the end. The articulator does not has an artificial intelligence that it corrects itself. Okay, so these are my references. I thank you all for listening to the Articulator series.